All right, thank you everyone for coming to our expert Q&A webinar on how we prepare for H5N1, measles, and COVID with Dr. Angelique Corthals. We appreciate you being here. We've fielded a lot of questions from the internet, so we're looking forward to going over those with our expert. But first, I will hand it over to our founder, Julie Lamb, to say a few words.
Welcome to our expert webinar with our scientific advisor, Dr. Angelique Corthals. My name is Julie Lamb. I'm a writer. I founded MaskTogetherAmerica in 2020 after I lost a friend who was a surgeon at Mount Sinai in New York. He contracted COVID working in the ER when masking wasn't mandated. Since I used to work as a creative director in advertising for accounts like Motorola, I couldn't just sit at home and watch this virus rip. Even during the lockdown, I took my camera out and photographed maskers and interviewed them wearing my own mask, because I believe that we have a voice and we need to speak up together. You can see the collage with pictures of these volunteers behind me. After 4 years, even though I'm now suffering from long COVID, after one infection during the winter wave in 2021, I still refuse to give up because awareness saves lives. MaskTogetherAmerica has been around for over 4 years. Now we have a strong team with volunteers across the US devoted to educating people about the layered approach in respiratory sickness prevention. This year, flu viruses, COVID-19, and other airborne pathogens are prevalent in certain parts of America. There were also 8 outbreaks of measles reported this year. New COVID variants are rising. JN1 has been replaced by a sublineage KP2. For seasonal influenza, CDC estimates that there have already been at least 34 million illnesses, 380,000 hospitalizations, and 24,000 deaths from flu so far this season. For COVID-19, the CDC has been forced to scale back tracking new infections or reporting data since 2023. Starting May 1st, US hospitals are no longer required to report COVID hospitalizations to our government when people rely on CDC for its data on hospitalizations to provide life-saving warnings. But HHS is proposing to have a new rule to require hospitals to report on respiratory viral infections, including flu, RSV, and COVID, and that's starting in October. We all have questions and concerns on how to protect humans and animals from getting sick. That's why our team called for a meeting today, which will follow the webinar. Without further ado, I'll pass the mic back to Sarah, who is the coordinator of MaskTogetherAmerica. Sarah will introduce Dr. Angelique Corthals to all of you. Thank you, Sarah.
Thank you, Julie. All right, Dr. Angelique Corthals is an associate professor for pathology, biomedicine, and epidemiology, biological, and forensic anthropology at the City University of New York, John Jay College of Criminal Justice. Dr. Corthals studies the link between neurodegeneration, pathogens, metabolism, as well as the histomorphology of trauma at CUNY. She also works with MSF, Doctors Without Borders, as a consultant on the diagnosis and treatment and vaccines and healthcare and medicine for all. She received 2 National Science Foundation grants to study COVID-19. We are so grateful to have an educator specializing in governmental pandemic preparedness as our advisor. So thank you for being here, Dr. Corthals. Our first question tonight deals with H5N1. How must the avian flu change before it can trigger a human pandemic? Is H5N1 just a matter of time now before it becomes a pandemic?
Yes, it is a matter of time. It's a matter of surveillance, and what the critical point at which the H5N1 is going to become a pandemic is when it has accumulated enough mutations to pass from person to person. Right now, it's still very much zoonotic, but once it transmits from person to person, it can potentially become a pandemic. The other key element, and this is what has made SARS-CoV-2 so efficient at becoming a pandemic virus, is the infectious stage being accompanied by symptoms or not. If it's a silent infectious phase like SARS-CoV-2, then it can potentially be an extremely serious pandemic. And of course, it's going to be a very serious pandemic because of the mortality rate of H5N1.
Is H5N1 neurotropic? Will an infection initiate central nervous system disorders such as neuroinflammation and neurodegeneration, including conditions like Parkinson's and Alzheimer's?
Obviously, we don't know yet, but there is, of course, a potential for H5N1 to be neurotropic. It's very clear that other flu, so other strains of the flu have been neurotropic, or as we call it, neurovirulent. But we don't know yet. But potentially every virus can have any kind of neurological effect down the line. The thing is, not every neurological condition is the same. I've described in a paper in 2012 how viruses are essentially trigger of underlying conditions, right? So in this case, I've described how any kind of virus infection or viral infection can trigger, for example, autoimmune diseases, including multiple sclerosis. Alzheimer's is now considered on the autoimmune spectrum. Parkinson's definitely is Sjogren disease, etc. So yes, it has a high potential for this, whether or not it's attributed to its particular strain or just because it's a virus.
Thank you. The CDC is asking its advisors on healthcare infection control to decide whether N95s or even more protective respirators should be required in healthcare settings for all pathogens that spread by air, or are widely used surgical masks enough?
Well, surgical masks are porous, so they're definitely not enough. They're to an extent, they would help. If anything else, if we had nothing else, they would certainly help. But N95 is the ultimate protector. Now, I understand as healthcare providers, I mean, N95, we all wear them all the time, right? I think I'm not going to try to convince anybody to present here to wear their N95, but they are not that comfortable, right? Let's just face it. They can irritate the bridge of your nose. They can irritate the area where it touches your skin. So there's a lot of comfort that's associated negatively with N95. So I can see how many healthcare providers are reluctant, but for example, wearing KN95s would tremendously help. And if everybody is masked, then you really are reducing the chances of transmission tremendously, right? It's never going to be zero, but it can be close to zero. With N95, it's as close to zero as we can. KN95, we have a slightly higher chance of transmission, but still at a very low level. With surgical mask, transmission may be higher still in levels that should not be permitted in a healthcare environment, I believe.
Thank you. Why do we need a new COVID booster every 6 months?
So we're doing very much the same thing with COVID as we're kind of doing for the flu. We're adjusting the vaccine every year. There is research for a polyvalent COVID vaccine that would essentially cover not just COVID-19, but all of the other coronaviruses, the first SARS strain, MERS, and COVID. Those vaccines are in development right now. What I'm not seeing, though, is a larger administrative executive order to make the process go faster. We need a warp speed, essentially, and we need that for the polyvalent vaccine, not just for COVID, by the way, but we should have this for the flu as well. And we also should change the way the vaccine is delivered. And it's been shown in many different studies that the intramuscular vaccines, which is what we get right now, is not as effective as a vaccine that is delivered intranasally would be especially for respiratory acquired diseases, because there is a big difference between a disease that's a respiratory disease and a disease that's respiratorily acquired, which is what COVID is. You inhale it, but it ends up being a systemic disease, while the flu is more located in the upper airways. Still, it's hard for me to answer that question, because I think we all know it and you want me to say it, but there isn't a will to develop the vaccine. And that's because of the debacle that we've seen in the fall vaccine, the fall booster, where only 2% of the population took the vaccine, took the booster. And so when you are a company like Pfizer, Moderna, or any other vaccine company that may be emerging, you're looking at those numbers and you're saying this is not profitable. And if we don't have a program that's specifically funded and that will help the development and the production of this vaccine by governments around the world, that vaccine, the research may be there, but that vaccine will never see the light of day. We need the political will to have this vaccine come out.
Kind of on that note, is the new JN1 booster that's going to come out in the fall effective at protecting us from a new wave?
Well, that's that's timely. Actually, we're having a new variant that's circulating, and we know that that variant is going to replace JN1. How protective the vaccine is going to be, we don't know yet, but we do know that the new variants, which we call FLIRT, is going to be more immune evasive than JN1. As usual, whatever you read on FLIRT, you're seeing more evasive, but don't worry, it's not as dangerous, which of course makes no sense. So a booster will always help to an extent. So I would always advise everybody to take that booster, because we know that the vaccine protection wanes after 6 months. So if you've had your last booster in the beginning of the year, this year, jump on that booster in the fall. Even if it doesn't match the variant, it still will help you protect. It will help protect you more than if you don't have the booster.
Why aren't COVID vaccine recipients told what the current rates of transmission protection are and the waning rates over time, since it does wane fairly quickly?
Right. So if you're a very good sleuth, you can find that on the so-called information pages of WHO or CDC. It's written in very small letters, and you have to go through 30 different links before you get to a paragraph, which most people who are not familiar with scientific writing would not be able to read and make sense of. So it's a way for administrations or NGOs to say, hey, the information is there, but at the same time, make it completely inaccessible. Again, here, the why is there is no political will. And in the United States, particularly this year, is going to be a tough year for all of us who are still protecting ourselves against COVID, still calling for mitigation, because it is an election year. And both parties want to claim that COVID no longer exists, or that, depending on the party, or that COVID was vanquished. And this is going to make life tremendously miserable. But there's also an opportunity in an election year to pressure politicians to actually do the right thing. And we can pressure more local politicians. Well, what we're going to have to do is the bottom up, the contrary to the trickle down. We're going to have to pressure the local politicians to go up the chain to actually pressure the federal politicians to have what we've been asking forever, which is that information campaign, which of course everybody refused to have because it would be admitting that COVID is still a problem, which it very much is. But right now we're brushing it under the carpet until it comes back to explode in our face.
So we've been seeing measles a lot in the news lately. How concerned should we be about measles, especially if we have received all of the vaccinations?
Right. So for the measles, if you've had the measles as a kid, or if you have had the vaccination, the science says that you are protected. However, to be absolutely sure, because as you grow older, your immunostatus changes, right? So to be absolutely sure that you are protected, that you are indeed immune to measles, you should go to your doctor, to your primary care physician. Ask for a very simple test. It's an antibody test that will see the titer of your antibody, so how much antibody against measles you have. If it's enough, great, you're protected. If it's not enough, then your primary care physician may recommend to have a measles vaccine booster. And yeah, you should be concerned because the measles is a very dangerous virus.
And just throwing this out there, I'm a fairly young-ish person, but I did get that titer taken at my last physical. And while I still had mumps immunity, I did not have any measles immunity. So it is good to ask, even if, that vaccine might be more recent in your history, or, it's good to know that that's an option out there. And I was able to go to Walgreens and get a booster like 15 minutes later. So pretty easy to take care of once you know your status, and it's really just a matter of getting into your doctor and asking for the test.
Absolutely. I mean, that shows that you're younger than me. I'm gonna age myself here, but vaccines were not widely available when I was young, and I literally just got the measles. And my titer is still okay, so I didn't have to get a booster, but it's always best to ask. Don't leave it as a question. Like, don't leave it as a certainty just because you've had the vaccine or have been exposed to it.
All right. Can a COVID infection trigger the development of osteoporosis? Does COVID infect the bones?
COVID can actually influence hormones. We know that, and this may in turn trigger these pesky little immune cells that are responsible for osteoporosis, called the osteoclasts, to go and scavenge calcium from your bones. It also can trigger a change in your metabolism, which, of course, the deposition of calcium in your bones depends on. So you depend on your metabolism to metabolize vitamin D3 that you're getting in from the sun, for exposures to the sun, or through dietary means, or calcium, for that matter, to deposit into your bones. Remember, calcium without vitamin D3 is pointless, right? You always have to have the two together. And so because COVID has been shown to dysregulate the metabolism and dysregulate hormones as well, there is a definite link between an increase of osteoporosis and COVID-19, especially for cases of long COVID and severe COVID.
Is long COVID just a problem for the patient community?
No, of course not. It's a ticking time bomb. And this is the problem. I think this is where the lack of information is just infuriating, because most people are going about their life thinking, A, kids do not get long COVID. B, I'm a young, healthy person. That's not going to happen to me. C, I've only had a mild case of COVID. That's not going to happen to me. It can happen to literally anybody, just like autoimmune diseases, just like cancer. COVID will, I like to say that there is a genetic component that makes you more likely to develop long COVID, and I know this is going into the next question, but there's environmental components that are just as important as the genetics, and all of that is not presented to the public in a clear manner. And I think that this ticking time bomb is going to really explode within the next 5 to 10 years, where we're already seeing the trend of increasing in long COVID and disability around the world, not just in the United States, and especially in young people. But I believe that this trend is going to become exponential in the next 5 years, unfortunately. And when our governments refuse to have this critical information presented to the public.
So that does tie into the next question. There's a study that shows that 3/4 of the population have genes that make them susceptible to getting long COVID. Does long COVID only affect people who have those genes?
Yeah, so this is always the problem when you do a large scale genomic comparison between long COVID patients and controls who do not have long COVID. All of those genetic markers that are found can be found in 3/4 of the population, and it literally will play more on the environment than on the genetic at this point. Sure, the genetics will make you more vulnerable, but the environment, and that's what you eat, your lifestyle, all of those, whether or not you're exposed to this or that, stress levels, all of this will play a role into your potential for developing long COVID. So while those studies are extremely useful to an extent, where we can really work work into providing more tailored solution for the different patients who have long COVID, because I don't believe there is such a thing as just one long COVID. There's multiple ways in which long COVID will affect a patient, and how the pathogenesis, which is basically how the disease works, arises first, and how it turns into this or that syndrome. These studies that have shown those biomarkers, which we call them, those genetic variations, will be very important into trying to tailor better treatment for long COVID. But we can't take that as to say, oh, well, I don't have those particular genetic variation in my genome. First of all, most of us don't know whether we have them or not, but it can be associated to an entire segment of the population, and you might be in it without noticing it. And it's very much widely represented in the world's population. So there's only very few populations that don't have some, at least, of these genetic markers. And so this is where it can become dangerous to not explain the fine points of studies like that, because people might feel that people with long COVID are a very specific segment of the population, and it doesn't affect them. Right? It needs, again, we need education here, and we need an education campaign that is effective, clear, and we don't want to make it alarmist, but we want people to actually have that information.
Thank you. All right, our last question for this segment. Is the CDC's vax and relax approach problematic?
Next. Yes. Yes, it is. It is, when we'll be long gone and our bones will have turned to dust, this period of history will be seen, and this particular public health segment will be seen as the worst possible intervention that has ever been dealt with during a major public health crisis. I would say vax and relax if we had a vaccine that was actually preventing transmission, but this is not what our vaccines do. And on top of that, it was shown very early on, we knew very early on that our vaccines were not preventing transmission. I mean, look at the Delta waves, right? But on top of that, it's waning so fast. The effects are waning so fast. Most people who've had the original vaccine have barely any antibodies left. If you haven't had a series of boosters after that, if you haven't uptaken any of the boosters after that, your protection is becoming almost null. By the time we're going to get to variant XYZ next year, that will be completely pointless, right? So we'll see more hospitalization that are totally preventable because of vax and relax, because people understand vax and relax as, oh, we no longer need, that's the only mitigation we need, the vaccination. And we know that this is not true. You need to keep that layered medication. We need again, politicians to understand that we need clean air in the buildings So we'll start with the clone. We'll start with what's closest to us, right? With the local politician. This is an election year, so this is a good time to pressure them into doing something, especially those local politicians. Federal, we can work on them, but let's start at the local politician level, and then move up the chain. For all of us here, I think we all understand that we need to keep a mask in our pockets whenever we go indoors or when we're in a crowded outdoor setting. We certainly can use any other mitigation that have been proven to have effect out there. I personally use the nasal spray, but I don't use it as an all or nothing, right? So I use it in combination with the masks. So layered medication is what we need to keep doing, and not the vax and relax, unfortunately, until that day where we may have a vaccine that is polyvalent and sterilizing, which means that it prevents transmission. Vax and relax is a terrible idea. It's actually great for the I mean, you'd think that COVID, or you'd think that SARS-CoV-2 wrote the vax and relax. I can actually see sort of a meme where SARS-CoV-2 as a virus goes, vax and relax. It helps me evolve. Terrible.
Well, thank you for that image.
Okay, you're welcome.
We are going to move into the community meeting portion. And so for that, I will turn it back to Julie once she unmutes.
Sarah, I think one person really want to ask a question. Maybe we can Dr. Corthals take a question?
Oh, yeah, absolutely. I'm happy to take questions.
Sarah, can you see the question that's in the chat?
Yes, so Rhett wanted to ask if you had a summary of the environmental factors for long COVID that you mentioned when we were talking about genetic factors.
I do. As a matter of fact, I actually, I have a series of, I have a manuscript that contains all of them, but in great summary, it's diet, environmental stressors, including stress, and uptake of so medical history, but also uptake of medicines, uptake of vitamins. So there's a whole list that I can share with everybody here, if you'd like.
Yeah, that would be great. Thank you.
Yeah. Mm-hmm. And I see there was also a question about blood pressure that somebody posted, or is it just am I not supposed to mention that? But anyway.
No, you can answer anything that you'd like.
Oh, okay. Well, so the blood pressure question. So somebody asked if it is possible for COVID to affect blood pressure, and absolutely. And in fact, there was a beautiful paper that was just published about the effect of COVID on the vagus nerve, which of course explain many other symptoms as well, since the vagus nerve has such an ubiquitous way of controlling a lot of our functional organs. So the vagus nerve, in part, is the regulator of blood pressure. So the in autopsied patients, we have seen that the SARS-CoV-2 virus was present in high number inside the vagus nerve, and that's actually how how COVID actually can have influence blood pressure either by raising it or lowering it.
Thank you. Julie, do you want to speak on the community portion?
Yes, so this is very important. Welcome to our community meeting. To start, I really would like to invite everyone to sign a letter that we wrote to NIH Director Dr. Monica Bertagnolli to ask NIH to restore the expand the home test to treat for COVID-19 and flu. So the NIH-sponsored pilot program was created, I think, a couple of years ago, and it allowed adults to who are uninsured or have Medicaid or Medicare or Indian Health Service or veteran coverage to enroll for free tests, telehealth, and treatment for both COVID and flu. But that ended in April. And this program also allowed people to get free health care at home treatment if you test positive for COVID and flu, regardless of your insurance. And we're very disappointed that they shut down this program, and we would like to fight back and ask NIH to restore and expand this program. So we're hoping that, everyone will sign this letter together with us. I'm going to drop this in the chat, and I hope that everyone here will sign it right now. Oops, let me see, everyone. So you can see the letter in the Google document. And of course, some of you probably know that we also have a letter campaign, which is on Action Network. That is a great tool for everyone to write to your government officials to ask for this home test to treat program. This home test to treat program really help prevent severe sickness because you get treated when you're sick and you don't have to leave home. You can get the telehealth service, which a doctor will talk to you and get you the prescription right away, which is the best way to prevent spreading the virus to other people. So we hope that everyone will sign this right now. And also, if you are part of an organization, we also would like to get sponsors to the letter to NIH, or if they want to sponsor us on Action Network as well. But as you can see, we already got how many organizations, Sarah? 15 or 14? We have about 14 organizations, I think.
I don't have an up-to-date count, but it's around 15 and more keep coming in every day.
Yeah, so this initiative is widely loved by all the advocacy organizations you can think of. Everybody really think that this is a great solution. I mean, one great tools to really add layers of protection. As Dr. Corthals say, we need the layered approach. And so this is a great way to prevent transmission of sickness, because if you cut off the source, people getting sick, having symptoms, and they stay home and get treated, then you basically stop the virus from spreading forward. So we hope that everyone will join us in this action. And other than that, we're open for other people to raise questions, or if you want to share what you're doing with the community, then that's what the meeting is for.
So yes, if you'd like to ask a question, or if you would like to just have the floor for a few minutes to kind of talk about really anything you want, where you're at with COVID, if you have any more questions or just things that you'd like to share with us, feel free to put a message in the chat and I can give you temporary speaking permissions. But otherwise, we are really appreciative that you're here. Kind of the main thing that we're hoping to accomplish tonight is to get some more signatures on our letter to support Test to Treat. So please check out those links in the chat. We've got the link to the letter itself, as well as the link to sign the letter, our Action Network link, and it looks like we do have a couple of other questions.
Oh,
But
Debbie just mentioned something I want to add is that in our letter, we also asked that besides asking for tests and treatment, we also want them to expand to include sending people respirators. So so that like, because you know, N95s are very expensive. So if someone is infected, it'll be great if this program also send people respirators so they can actually wear masks and prevent sickness. Yeah, that'd be great point. I guess like some people are asking Dr. Corthals questions.
Yeah, I'm sorry, I'm trying to answer by typing, but yeah. The question was what I'm personally doing to prepare for H5N1, and I was basically saying that I'm buying my N95 in bulk. I am. I mean, I'm not gonna lie. This is exactly what I'm doing. I'm just stocking up on N95 and definitely keeping keep the monitoring close. Make sure that I know, you know, where it's going at what point, and then just trying. But of course, I have my own channels that help me monitor this more closely than the CDC, and also very importantly, do not drink raw milk. I don't know why people have started drinking raw milk after the discovery of pasteurization, but don't drink it.
Dr. Corthals, I have a question for you. Do we have to be concerned about like, say, feeding wild birds? Like
So that's a
outside,
very
you know, if we see like beautiful, you know, like all these birds in the garden, and should we be concerned about that?
That's an excellent question. Yes, you shouldn't be concerned yourself about feeding the birds, but what you should be concerned about the cleanliness of the bird feeder. To an extent, look at there are so the US Fish and Wildlife does have levels of avian flu on their websites. So if you are in an area where there's a particularly bad outbreak, because the outbreaks are seasonal with H5N1, I would actually discourage feeding the birds unless you've really washed your feeders well with bleach, and make sure that every time you refill them, you wash them with bleach. You do want to, unfortunately, this is terrible to say, but you want to discourage bird gathering in the same place as much as possible. And feeders are unfortunately what happens. They do gather at the feeders, so that's a way that they can spread. But just know that not every bird is affected the same way. So generally, the birds that we feed at the feeders, those are the little the cute little ones, right? The wrens, the sparrows, the goldfinch, the birds that actually spread H5N1 the most are the waterfowls. So the most the biggest host of H5N1 are the mallard ducks. And so they tend to spread the virus around. So try not to feed the ducks. That's a sad thing to say, but if you're feeding the ducks, other birds will come as well, and they may actually get they may actually get contaminated. Again, it's seasonal, so now is the most critical time for the spread of H5N1 through the bird migration. During the summer, it's actually fine, but the spring and the late fall, as the birds are ready to migrate again, are periods that you should refrain from feeding, from having gathering of birds. So the summer and the winter is fine. But always wash those bird feeders with bleach, not with soap, with bleach.
Debbie also asked in chat if people should be keeping their birds, not their birds, sorry, their cats indoors.
Oh, I see. I suppose, so you're afraid of the cats catching it from getting a bird, right? Like from hunting birds. I haven't seen that cats are infected in huge numbers. So, but cats should be indoors anyway, I'm sorry to say, because they are depleting our birds and rodent populations, our native birds and rodents populations. So if you have cats, the wise thing to do is to keep them inside. For many different reasons, but one of the main reason is the ecological, they are an ecological disaster on our birds and our native rodents.
I know that there have been some articles about cats getting H5N1 and dying. I believe a lot of those were related to farm cats that were drinking the raw milk on the dairy processing. So I don't know if it's necessarily related to them just being around birds as much as it is that they were consuming the milk.
Yeah, no, they're consuming the milk, but it has nothing to do with them hunting birds.
So if you take one thing away from tonight, don't drink raw milk.
Do not drink raw milk. Keep your keep your cats inside, and bleach your feeders. Also, don't eat raw eggs. Just saying.
I've seen some people asking online if they should be cooking their eggs completely, like no sunny side up eggs, if they should be doing just scrambled, nothing with a runny yolk.
It's actually fine. I mean, just don't have it raw, but yeah, if it's a little runny, it's not a problem. The name of my African gray is Algernon. Algernon, come, somebody wants to say hi. Hang on, I'm gonna take your toy away. Say hi, Algernon. And she is named, I know it's a she's named Algernon after flowers for Algernon. That's right, you're the smart one. You know it. Yes. Would you mind posting the idea? Oh yes, no, of course, I will post that immediately.
Thank you to everyone who is signing the letter. We really appreciate that.
I'd love to play with Algernon.
Sorry?
I'd love to play with Algernon.
You and many. but Algernon is a very yes, she's got a following. I should actually be one of those influencers Instagram with my pet, but yeah. Okay, so here is one of, oh shoot, sorry, I've had
cold milk is fine.
Sorry?
Pasteurized. Michael asked a question about whether cold milk is okay to drink. Cold milk is fine.
Yeah, as long as it's been pasteurized. Yeah, absolutely.
And I think in fact, if it's in a grocery store, it has to be pasteurized. I don't think it's you can't sell raw milk at a grocery store. So if you're buying it at a grocery store, it should be fine. It's really just if you went to a farm and you happen to have a relationship with a farmer who was offering raw milk, then that would be what you'd want to say no to. But if you're buying it from a grocery store, you're safe.
Yeah, are you having a difficult time asking for cauliflower? yeah, I mean, I've tried. But I try not to ask people to mask. I go around like sort of a roundabout way where I try to bring them to the realization that it's a smart thing to mask rather than ask people to do something. Because if you ask people to do something, they'll say no, right? It's kind of it's a weird way that especially here, I've noticed that if you are, especially in a group, in specific professional groups, if you ask people to do something, they're just not going to do it. They're going to put up a wall immediately. So rather than asking, I explain why I'm wearing a mask, and I try to give a very good point about why that's a smart thing to do. And it works with the students. I explained to the students in my very first lecture why I wear a mask, and I don't try to make them wear it, but I noticed that after the first lecture, the next time we assemble, there's usually more students coming in with a mask in class than they were at the beginning. So it has some effect, I guess. But there's a lot of reluctance with the masks, and I don't understand. It's such a simple tool, but this is this problem with COVID, is that we are in a situation where we really need not just the education, but also the means to provide these masks to everybody, right? Not everybody can afford that. Just not everybody can afford the PCR tests. I mean, almost nobody can afford the PCR tests now. Should we be concerned that H5N1 has been showing up in grocery store milk? Oh, okay, no. So just to explain very quickly, so the way the H5N1 has been discovered in milk is by PCR, but they were looking for a very short segment of the genome of H5N1 that so they didn't recover the actual full virus, they recovered fragments of the virus. So it's very unlikely that it was a livable infectious virus found in the commercial products.
It's not that the milk tested positive as much as it is that fragments of the flu were found in the milk. Is that kind of a way to say it, maybe?
That is correct. Yes. So any fragments of the virus will test positive by PCR because it's such a sensitive test. So that's why we use it. I use it on DNA that's thousands of years old. And that's because it can detect minute amount of DNA in very damaged cells.
Do they have a test for H5N1 for a human right now?
No, there's no rapid test right now. There's only PCR tests.
And are there treatment for that developed, like in development, like just in case it becomes something?
Well, so right now I've heard that there's a couple of vaccines that are there's a couple of companies that are pivoting to H5N1 vaccines, and they're there's no treatment right now for H5N1 beyond what we have for the flu. So not a lot. As I could, no, don't catch it.
So the vaccines will be like a flu shot.
It would be like the flu shot, yes. And there's a few companies, but it's, it's a special kind of flu. It's not at all the same strain as the one that we have for our
A and B.
for A and B, yes. So they need to develop that, and the mortality is high in H5N1. So again, my best recommendation right now is keep those N95 close.
Kind of on that note, we're getting close to the end of our meeting. Is there anything that you would like to soapbox about related to H5N1, COVID, where we are, where we're heading? Anything that we didn't talk about already tonight?
Will the regular flu shot provide any level of protection? Not really. It's too different from the regular flu shot that we get.
Do you know when that will be ready? That vaccine that they're working on?
No, and I suspect that they don't know either, because of course mutations are random and we are not certain where they will appear to make the jump from person to person possible. So it makes it very difficult. It basically becomes a predictive game to manufacture a vaccine that's going to be efficient. I know. Yeah, I know. Yes. And I don't know if, by the way, I don't know if you've seen the evolutionary studies on the actual virus that infected the farm worker in Texas. But what's interesting is that what he got, or at least through the analysis of the different H5N1 viruses from the cattle, from the birds, and from that patient, it doesn't seem to be any closely related to the cattle virus, but it's actually more closely related to the original bird virus, which is really interesting and kind of scary in and of itself, because that means that it's already made a huge jump, evolutionarily speaking.
All right. Well, I think we are at the end of our time. So I just wanted to say thank you to everyone for attending. Thank you for your questions. Thank you, Dr. Corthals, for your answers.
My pleasure.
And as always, thanks for sticking it out with us and participating. We appreciate you signing the letter. We appreciate you sending us mask portraits for our page. We appreciate you volunteering with us. If you're interested in doing more with us, you can always email MaskTogetherAmerica@gmail.com. We have Facebook, Instagram, X, Threads. I think that's it. I'm always worried on this one. We have a Facebook group. It's called Mask With Us. And you are welcome to engage with us on any of our platforms, all of our platforms. And we look forward to seeing you in the future. So thank you very much. Have a wonderful rest of your night.